Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568, and phone number 408 687 1899. Email address homeomedicine@yahoo.com. Anytime, at any age, for any disease, when you are suffering and tired of any treatment, please call me for your second opinion of the disease. And even if you are interested in homeopathic scientific approach to your health for all the diseases from head to heel, you can call me at 408 687 1899 or contact me by any media, email, message, phone number. You will get your answer of your disease. To consult, it's a free. There is no consultation charges when you call me to consult your disease. And it's not binding on you that you have to take treatment from me wherever you are. Wherever you are getting treatment, it's okay. But I can just tell you there are principles of nature. When there was no medical science, doctors were not there. Before the origin of this medical science, even then, people were suffering at that time from the different various diseases and they were being cured. What was that who cured? That was the immunity. And that immunity is given by the God, by the nature, when this body was created. And also, there was a procedure, there are the line markings, how the nature was curing all these things. How our immunity, just like in the other words, you can say, how our immunity was overcoming all the diseases. Okay, when they suffer from diseases, how they get rid of all those diseases. So this is all about our vitality, all about our immunity, which is given by the God, by the nature at the startup of our life. And in this way, we have learned from that. There was no reversal at that time. Whatever the nature was curing at one time, it was cured for all, forever, unless and until the same person exposed to the same type of disease producing causes, exposures, he do not suffer from those things. And even it was also a factor that if after suffering from one type of disease, for one type of ailments, he has been cured by the nature. Nature itself establish a center for further in life. If ever the similar type of causes affects the body, it will be automatically cured or they will not overpower our vitality. Means we will not suffer from similar kind of diseases. This was nature's process. And this is what we have learned from the study of the natures. And I'm talking about if you are suffering from similar type of conditions and now taking the treatments and fed up after a long time of the treatments of different type of treatments of different type of doctors you are going to, I can just guide you and I can just explain you what the process of nature, if the nature has to cure those diseases, how it will tackle it, and how the medicines, especially the homeopathic medicines, can help your body, can help your systems to recover again in a safest way, because there is a specific type of definition of the cure, that the cure should be rapid because persons are already suffering, and as soon as possible they should recover, but sometimes there is a lingering process of the disease lingering process of the treatments, and patients are suffering for a long period from the similar type of symptoms. That is why it has considered that as far as possible, the process of cure should be rapid, as fast as it could be. Rapid treatment. Okay, your disease should go in a short way. And the second thing, when you are treating a patient, or when any person is being treated with any disease, it should be in a gentle way. The processes, the way which are adopted for this cure should be gentle ways. Many times, my thing, you might have heard about that. People were going to the saints in different categories of the saints, and they were beating the persons just to get rid of the disease. They were giving smells of notorious things to them, just like the pepper and all that fun. It was unbearable for the patients. The patients are already suffering. And even for the chronic ulcers, you might have heard about from the villages that their wounds were burnt by the hard or live tar wires and hot wires. It is not a gentle way of. Now, the similar type of things are adopted by the medical science, but the way they are trying to make it gentle by making the patient unconscious, just like giving anesthesia, but just like electric shocks are given. Electric shocks are given to the patients. It's not a gentle way, though they are trying to make it gentle way by giving anesthesia, making unconscious to the patients. But same thing, the tissues has suffered too. His body tissues are suffering the similar type of pain, but he's unable to explain those things. Ultimately, these type of alternative treatments cause pain, deteriorate your health, affects your health in a bad way. And after that, for a longer period, patient suffers from, not from the disease, but from the way adopted to treat the disease. Whatever means are adopted for curing the disease, those means are more painful after that, because diseases are having their normal periods. Just like I many times explained in these lectures, chronic and acute diseases. Acute diseases has their limited periods, and after that they will go off if they are not complicated. If they are not complicated, they will go in a short way. And in the meantime, during course of the disease, they may harm, they may cause damage inside your body, but ultimately they go off. Whereas the concept of chronic diseases is that they linger on, they go on increasing, they go on with your life, and ultimately they end up with your life. There's a difference. In this way, when we are adopting some type of means to cure any type of disease, maybe ulcer, maybe symptomatic, any other problems inside the body, and we are adopting the means which are not according to nature's process, they are not gentle at all. And when they are not gentle at all, ultimately when the person will become conscious, he has to suffer with that one. He has to suffer the pain of those things. His tissue has to respond to that pain which they have gone under anesthesia. So this is not considered the gentle way. The second thing, the first thing, the process of cure or the treatment should be rapid. As far as possible, we should treat the patient in a rapid way, the shortest time period, so that he should be cured from his pain. Second thing, the way we are adopting to cure his disease or to relieving him from pain should be gentle way as far as possible. In the previous way, I told you it was not a gentle way, but now even those type of kind of treatments are still adopted, but they are adopted under anesthesia. Doesn't mean that the tissues do not feel that. They feel that. In this way, second thing is that whenever you treat any patient, whenever you are suffering and getting rid of those diseases, means that one whosoever treat your disease, it should be in a permanent way. Permanent way means whatever are the causes. First of all, we should learn about those causes which has produced a disease condition in an individual person. And after learning about those causes which have produced this kind of disease symptoms in an individual case, those should be removed. First thing. And after that, whatever they have damaged inside your body, that should be recovered in total permanent way, and that so that the same type of symptoms should not come again. Same type of symptoms should not come again in the same persons. And what we are doing in nowadays, if your treatment is passing through this type of conditions, that every 6 months, every shortened while, after sometimes you are going to the same doctor or going to the different doctors for the similar type of conditions, and repeatedly you are going for that one, it means the treatment was not according to that chain prescribed for curing a sick person. Rapid, gentle, and permanent means the cure is not permanent. And if the cure is not permanent, it means this is not considered the curative treatment. It may be considered as palliative, as temporary, that temporarily you have relieved this thing. I can just give you one example about that one. A person is having a pain abdomen, and you give something to him, and he is relieved from his pain. And just think, this pain abdomen was because of indigestions, any kind, indigestion, constipation, whatever. If in due time, if within the time frame of action of that medication in your body, those symptoms are relieved, just like if you have eaten something undigestible and ultimately it will be digested, may take little bit more times. Suppose if normal food is taken, that is digested within 3 to 4 hours. But if something extra has been taken, some hard has been taken inside the body, that may take 4 or 5 hours to digest, and ultimately it will go off. And if your medication has its effect until that 5 hours are crossed, and ultimately after the 5 hours crossed, he will not having the same symptom. And till that, just like we say that this medicine has its effect for 4, 5, 6 hours, and after that you have to repeat, you have to take the medicine. What does it indicate? It indicates that this body do not accept any extra thing to put inside this body, whatever may be his reason, whatever may be his effect, or you can say the usefulness of this medication to the body. This body excrete everything outsider which is not accepted by this body. These medicines are not the normal food. So ultimately, they are pressing, they are subsiding your nervous system so that you should not feel the pain. Your brain should not feel the pain. That signal is from the complaint side is going to the brain, and brain said, "Oh, I have a pain in abdomen." Means the abdominal nerves are sending messages to the brain that there is some problem, and that problem is indicated in the shape of pain. And ultimately the body tries to excrete this medications from its body, and there are different time frames for each and every medicines, that within this period this medicine will be excreted and you need more medicine. Up to this, at this time, the concentration of this medicine will remain inside the body, maybe in the blood, maybe in the cells, maybe in the tissues, wherever, and till that you will not feel pain, you will not feel any complaints. And ultimately, when this body will excrete this medication out of the body, because this is not the part of the body, it's a normal routine of the body. Even if you take tea, your routine, but even then, after sometimes you feel yawning, tiredness. Again, you need to take tea. The same way drunkards, they take a peg, and ultimately after sometimes they, when evening comes, they said, no, yeah, we should take a peg. In the same way, nature has its process to evacuate everything from the body in a limited period. And after that, the same condition comes up. The same way, during the disease processes, if you are taking any medications to relieve the pain, and that has relieved the pain, but doctor says after some times you have to repeat the medicines. Till that, if the underlying processes, underlying abnormality, underlying indigestion has been overruled, recovered, digested, then after that you will not feel the pain. Even the effect of the medicine is over, and the credit will go to that medication. Oh, you took that medication, that get rid of you the pain abdomen, and that's a good medicine for that one. But ultimately you should know this thing, that this pain was because of the indigestion, and indigestion is a acute process which has to take sometimes it may be little bit more time, and within that time frame, that process has been digested, that thing has been digested which was causing the pain abdomen. Until that, the telephone line, the signals from that intestines or the abdomen, which was going to the brain that there is something wrong, now it's over. But just remember, I want to convey you the exact thing about this one. Just remember, you are having, or anybody is having, cancer in the stomach, cancer anywhere, and you take some painkillers, you take some medications which relieves your pain. What will happen? There is a limited period of that painkiller medication or that medication which is relieving your pain, and ultimately the body will excrete it. Suppose if the medicine remains inside the body, why you will feel pain? You feel pain because that has been excreted from your body by the urination, or by sweating, or by breathing or anything. It has been released from the body. That is why you start again feel pain. But if there is a cancerous type of development which is not going to be resolved within 3, 4, 5, 6 hours, it has to take long time, or may not be in a recovery process. Ultimately, what will happen? You will continue to taking those medications, and ultimately disease will go on increasing, because you are not taking anything, any step to recover that cancerous stage. You are just taking medications for that one. Under those conditions, what will happen? The dose of your medication, the painkiller, whatever you are taking, will increase time to time. And ultimately, the stage will come when your vitality will become more weak, weaker and weaker, and ultimately you will not be able to bear that medications in your system, so that you can be relieved from the pains. That stages come, and every day you see that in blood pressure, in sugar patients, and in cancer patients, in different kind of chronic type of conditions. You continue rheumatoid arthritis, you continue taking medications, and ultimately the doctor says, no, you have to increase the dose. Now you need more dose. Means The disease inside is increasing because we have done nothing to cure the disease. And it is because that we do not know the reasons behind that disease and we have not relieved those, or we are ignorant, or we are unable to relieve those causes which are causing the rheumatoid arthritis, which are causing the cancer type of things. We are unable to, and we have not identified the causes, and we have not relieved those causes, remove those causes, and ultimately the disease is going on, and ultimately your dose is increased. Every day you see this is happening in all the conditions, wherever the doctors are prescribing any medications, and they say now you have to increase your disease. So in this way, I just want to inform you that as a physical matter, if you are considering, because this concept is a homeopathic concept, we have to find out the causes and we have to relieve the causes. If you know the causes behind these, ultimately ultimately you have rooted it out, and ultimately the tree will fall down, and ultimately you will be cured, even if you are not taking any other medications. But if it's a long standing, if it's a more painful, yes, you need to relieve those things, but ultimately the causes are relieved. Ultimately producing those which were producing the disease conditions, they have gone. Now no more you are taking this kind of conditions which were causing, creating the problems. Maybe your eating habits, maybe your living habits, maybe your environmental habits, whatever it was, has you have identified that and you have stopped that. And ultimately, no matter whether it is cancer, whether it is a simple thing or any other rheumatoid arthritis type of things, you will start feeling better the day one onward. And then the medicine disease dose will not increase. So, after explaining all this thing, so permanent inhalation will occur if you find out the causes behind every disease in its whole extent. What happens? Nowadays, there are different doctors for different systems. Every system has their own scholar, own doctor, and every doctor is diagnosing its own organ and give name to their disease. And sometimes it happens there are many more diagnoses in one body. Whereas when doing this thing, we are forgetting the concept of single unit of this life. This life is a single unit. This life, when it is existing inside this body, all the systems are working. But when that life process is not inside this body, all the organs remains there, but they do not work. It means the solely for functioning of this body, normal or abnormal, healthy or disease process, disease functioning of this body depends upon that life. It means if you know that the responsible party for this body functioning, normal or abnormal, is the life process, and how it is recognized, then the process starts. How it is recognized? It is recognized by the normal functioning of each and every organ. What's the normal function? We see through the eyes. We see the function, how the eyes are functioning. We see the nose, how it breathes. We know the functioning of the nose. We see the mouth, everything, every organ, lungs, heart, kidney, everything. Now we know the process because it's known as in physiology, and we know the structure as anatomy, structural formation, and the functional formation of all the organs. Now we know as a doctor that how it works. And when it is working normally, you do not feel, just like you buy a car. You buy a new car and the car will start, and you are standing on side by the car, you will not feel whether the car is started running or not. No, not at all, because it's a noiseless. As long as it becomes diseased, it becomes sick, it becomes abnormal, there is any problem inside the car engine, you will start feeling noises, different kinds of. The same way is this body. When body is healthy, you do not feel taking breaths. Body is healthy, you do not have any problem in seeing far distance and nearby, reading or everything. When you are going upstairs, when you are running, you do not feel that heart is palpating. There is a painful things. No. All the you are breathing normally, you are urinating normally, you are passing stool normally. Means if every function of all the organs whichsoever is known to us, okay, these are the organs inside the body, these are the systems inside the body, they all are working normally. And the responsible party of all these normal functioning is the life force. If that life force is defective, suppose if it is not defective, anything happens from the outside exposure, that vital force, that vital principle, life processes will fight with that, and in a due course you will be all right even without taking any medication or help. Not every people is taking medication, not the animals and not the birds and all those, they are taking medications. Now they are making the hospitals of the animals and birds and all that different, because when they are become homely, when they are caged in us, like us in the universe. But if they are free in the sky, they don't need any treatments. They were treated by themselves. Their vitality was stronger enough to make them healthy all the times and to fight with the all disease producing things in their systems. In this way, if you are feeling okay for all the systems, for all the functioning of the body, it means person is healthy. It means life force, life processes is not having any problem, and it's not indicating. But whenever there is any exposure, external or internal, I told you about there are two types of disease producing causes mainly, external and internal. And if everything is okay from inside, if everything was okay from outside, but now because of some reasons anything has happened, anything has happened to this vitality, and some of the functions, not only one thing I am considering, some of the function from all the systems is not going normally. It means vitality is suffering and fighting with that exposure from the outside and trying to overcome. If in due course that exposure from the outside has gone off, ultimately you will recover from that one. But if that exposure does not go off and even you do not recognize that, you will suffer, and the suffering will continue until you know about that one, or until the period of that outside exposure has itself gone. I told you, all the exposures, all the disease producing mechanisms has a timely fashion, and within a timely fashion they go off, and ultimately you will recover from that one. Even the vitality was weaker, but it was producing the symptoms at that time. Now that timely fashion has come up, and the outside exposure means you were living in a very very cold area, you were living in where there is a AC is on, but now your body does not feel better in the ACs, and ultimately you recognize and you stay home for 2 3 days, do not go to office in the ACs, and you take precautions, ultimately you recover. Means the exposure was off, ultimately the vitality recovers. But sometimes these kind of exposures, these kind of disease producing external affairs are continuing, and you do not know about that one, and then whatever you do, everything is palliative, not curing, because you are not relieving the causes of the disease, because you do not know about that one. If you know about that one, definitely you will try. Just like you go to the doctor and ultimately you ask doctor, what should I eat? What should I not eat? Means precautions. And the doctor tell you if he knows about the disease producing causes inside your body. What may be the possible causes which is producing this abnormality, which is considered as disease inside your body? And if he knows about that, he will, oh, you are not to do this thing. You are not to live in this way. You are not to eat this thing. He will guide you. So this is the process normally. So in this way, when all this process is going on, ultimately it depends upon whether you know about the causes producing disease producing causes or not. If you know that, definitely you will try to avoid those things. And if you try to avoid those things and you avoid it, ultimately the disease will go off. It is now stepping back, whether slowly or fast, it will step back and you will be cured. So, after explaining this process of the disease, I can guide you wherever your treatment is, whosoever treating you, but I can guide you whether the normal process is going on in your treatment or not. One more thing I can explain over here before I go into the topics of the cell, which we are going regularly as a series of lectures. Uh, you are coming from anywhere to your doctor's clinic. Ultimately, on the way, you will pass through any villages, any city, any exits. Then, when you go back from doctor's clinic, if all those exits, all those villages comes in your way in a reverse order, in a which was coming the last one, that will come first. And ultimately, after going out from home, whatever you see, whatever the first village come, will come the last. And ultimately, if that process follows with your treatment, suppose you go to the doctor take up the history. Oh, when it happens, what happens, how it progresses, then what happens. Ultimately, doctor write down the complete history of your patients. And ultimately, you know that what was happened first, what was happened after that, what was happened after that. And ultimately, doctor, I am with you now. And doctor made a chain, the route. He knows the route about that one. And ultimately, if with the treatments, for any treatments, if all those symptoms which were having a sequence of its appearance, how the symptoms were appearing inside your body, there is a sequence, there is a chain. And if with any treatments, whatsoever treatment, whatever may be the pathy, I'm not concerned with that. Every pathy is respectful. Every pathy has its own course. Every pathy has its own scope in the treatment of the health. So, if with any treatment your symptoms are going back towards the same route, it indicates your treatment is right. Wherever you are, it is right. And ultimately, you will reach home. And what is home in health? Healthy body. You are healthy body. You become sick by any other chances, by any other causes. You go to the doctor and the doctor take up your history. What happens, when happens, after that what happens, and ultimately the present condition by which you are in the doctor's office, if it starts going backward with the treatment of the doctor, with the suggestions, with the precautions of the doctors, ultimately you start going back, it means the treatment was right, guidance was right. If the treatment means medicines, management and the medicines, if the medicines is right, if the management means whatever doctor advises you to you take or not to take, you take precautions from all these things. That's also a part of the management. That's also a part of the treatment. Medicine and the management. If the doctor, whatever advises you, and with that, your disease goes backward from the same route, treatment is right. So this is what, in every case of disease, I can guide you from my 52 years of experience of treating the patients in these lines, and you can get rid of those things. But if the treatment is not going according to these lines, it means you have to change the medications, you have to change the way of treatment, you have to even maybe you have to change the system of treatments, and you have to change the doctor even. So in this way, I can guide you if you are suffering from any type of conditions. So in my routine lectures, in the series of lectures, I was discussing this thing. But one thing more still I have to explain in these chapters, that permanent inhalation of the disease means the disease should go permanently in its whole extent. In its whole extent means every system of the body should work normally. Does not mean that you have gone for vomiting and pain abdomen, and if the pain abdomen has gone, or if you are not vomiting now onward, it means you are cured. No, there is still swelling, there are still signs and symptoms that you are feeling indigestion, that you are feeling uneasiness, all the, until you start feeling totally normal, you are not cured. Cured will be considered only when everything comes to normal and you go to the normal functioning of your body, breathing, digestion, excretion, secretions, everything is going normal, then you are normal. But what happens? Normally, the treatments are given just to relieve the painful symptoms of the patients. For what the patient goes to the doctor? Patient goes to the doctor only when he feels pain. Yeah, this is disturbing me. I want to relieve this. I want to get rid of this. And the doctor gives you the medications to relieve those things. But it does not mean that you are cured with that one. You have to find out the reasons behind that, why it happened with you. And unless you find out those reasons, you will suffer again and again with the similar type of problems. So this is what explains in its whole extent. Just like one more example I can give you. Just like I give you the examples of this abdominal pain and cancer. If there is a cancer, it will not be relieved with the similar type of medicines time and again. It needs more medication, and ultimately it will come to the extent that you cannot bear that painkiller medications, or you have to need to take extra medications for that one, because the causes which was causing that pain is stronger, is not relieved permanently, and you will not be relieved from the taking the medications. On the other hand, one other example I can give you here. Every day you see patients are going to the doctor just like asthma. I can give you the example of asthma. In asthma, we go to the doctors and they give you some bronchodilator. What's asthma? Asthma is maybe the dryness of the bronchial tubes, dryness of the alveoli inside the lungs, and the normal air is passing difficulty. There is a problem in passing the normal air into the lungs. Maybe dryness, maybe ulceration, maybe constriction, whatever may be the cause of that one. And that is known as asthma. That's known as respiratory problems. We have different names: bronchitis, lobar pneumonia, TB, asthma. There are many more conditions which causes the problem in the respirations. But we are just giving one example to let you know that how it is temporary. Means you take something to dilate the bronchus, and you just facilitate with that medications that now the bronchus are allowing the outside air to go in and the carbon and other notorious gases to come out. So come out is it's a mechanical process. As many time I told you, why the oxygen goes into the lungs, because oxygen is heavier than the carbon dioxide. Carbon dioxide and the other notorious gases, nitrogenous gases, which are collected from the tissues after using the oxygen, and there is a waste product coming out of the cells that is lighter. If that is lighter, automatically when the air will go in, means having oxygen in that one, carbon dioxide with the same ratio will go out. The respiration starts. But in this process, if you feel pain, means something is obstructing this normal go off, normal show of air going in or coming out. And we called it asthma. And now, thinking that we have to relieve this thing, the doctor prescribed something like bronchodilator. That's known as bronchodilator, so that we can make this wider way to pass the air, wider way to pass out the air or carbon. That basically that's the air. So ultimately, the temporarily that person is relieved of his painful respirations for time being. And again, next day, he has to take the same thing. Again, he has to continue taking that kind of things, because, and this will continue until you know about the reasons. I told you about the eating habits, living habits, environments, and everything which is causing this kind of conditions. Then you have to get rid of that one. And if you get rid of that one, ultimately this condition will no longer remain with you. Ultimately, you will feel better and you will be okay. That's why the doctor told you, oh, you have to go to the hill station. Oh, you have to go to the dry places. In this way, humidity and all that, all the doctor prescribes you to change your environment, because they know that your disease is pertaining to this thing. The disease is because of this environment, because of this food, because of this habit. And if you get rid of that habits, that environment, that eating foods, ultimately the disease will start going back. Automatically, you will be relieved. So when you take any treatment, partially it relieves your conditions of pain, of disturbance in health, and it comes time but again, and you are habitual, you are addicted to take that thing. It's not complete, because the definition of the cure says the cure should be rapid, gentle, permanent inhalation of the disease in its whole extent. Whole extent means as a whole. After that, there is no more disease, there is no more medicine is required. That is known as the cure. So in this way, when nowadays, because we are more materialistic, in my previous lecture I have given you the examples when our old system of Ayurveda and old system of Unani was dealing with or knowing about this body function and body structures, and they were knowing it even without the instruments. Nowadays we have many more machinery and diagnostic measures, simple stethoscope to onward microscopic things and many things. But because we learn or we understand the language which is physical language, which we can show and explain in a physical things. Microscope, we can show that the ultimate, the minimum structure of the disease, we can see it into the cell. For any disease, maybe abdominal problems, maybe respiratory problems, maybe heart problems. Ultimately, this is some type of change inside the cell. And serial wise, I'm giving you those informations that what type of organelles are working inside the cell, and what type of organelle has what type of responsibility to perform the function. When I say cell, means doesn't mean one cell. Cell unites, form the tissue. Tissue unites, form the organs. Organ unites, form the system. System unites, form this whole body. In this way, we are at the minimum single unit of the body. What happens inside the cell when a person feels sick? Symptoms are out widely expresses. We see the symptoms, the patient, because we have our criteria. Inspection of the patient, how he feels, how we can see his face, his nose, his eyes, his color, and everything. When a person is sick, he does not look like healthy persons. So inspection, percussion, palpation, auscultations, these are the steps of diagnosis. We diagnose the conditions. And in this way, now we have gone to the last stage, auscultation. Means basically, auscultation was first of all limited only to the stethoscope. We check the stethoscope, we check the noises, because we have in our mind that what's the normal noise of the lungs, what's the normal noise of the heart, what's the normal noise of the intestines, different organs. We have the noises in our mind, just like all the different animals or birds, they cry, they speak, and they have their different languages. We can understand, oh, there's a peacock, or there's a hen, from the voices. The same way we understand the language of the organs when they speak in their sickness. And we are discussing here what happens inside the cell when a person falls sick, feels sick. And ultimately, we are describing in these lectures that because there are nine systems working inside the body, it means not only one thing is responsible in the cell, because in cell, no, cell itself is a unit of many other organelles. And many other organelles, individual organelles, are having their individual responsibility. One house does not mean that as a whole is responsible any irrelevancy to run into the society. No, because if ever anything goes in relevance in the society from any house, it means it was the responsibility of that person, his son, his daughter, his father, his every person has the different responsibilities at home. The same way, if cell becomes sick, it does not mean that we are free to saying, oh, cell is damaged. No. What is damaged? Because now we are going back to words. So now we are trying to find it out what goes wrong in the cell. Whose responsibility was if a person is suffering from asthma, if a person is suffering from any heart problems? What is wrong in that cell? Who was responsible for performing the normal duty of the heart? Whatever is going wrong, who was responsible in the cell for the normal respiration? So we have to trace out all these things one by one, one by one. And previously, I have given you that yes, we are at the door of the cell, and cell is a fort, and fort has a wall that is known as cell membrane. And cell membrane is not having any door like the other forts are having. Red Fort in Delhi, we have we have the doors to enter into it. We know that. But this cell has no door at all. Then how the things go inside and comes outside? How the food and air, oxygen goes inside the cell to breathe, to live, and how the garbage is coming out? And that process I have told you known as permeability by pressure. I have given you many examples in my previous lectures about this one, because we have already passed about the cell membrane, function of the cell membrane, and if the cell membrane is damaged, what happens, how the food goes inside in the cell with the pressure, that is permeability, how the garbage comes out from the cell, it is also permeability, how the pressures are increasing and decreasing with our eating habits and digestions. All these things I have already explained to you. And ultimately, I have explained to you that if that cell membrane is damaged, it's everything is controlled. Everything is controlled way, and person is healthy. But if that cell membrane is damaged, means anybody can go inside. There's no door in our house. Everybody can come and anybody can go out. Custom department, just like I give you the examples of custom department. And if custom department is not active, any person from the other country can come into our country. Any person from this country, after doing any sin, anything, can go outside this country. This is a barrier. So cell membrane, I describe you about the cell membrane, and if that cell membrane is damaged by hook or crook or by some other reasons, whatever may be the reasons, I told already all these things. What were the reasons behind this thing? How the cell membrane is damaged, and then what will happen? What are the diseases caused after that if the cell membrane is damaged, and how these are caused? I have explained you about that one. And then responsibilities of the cell membrane. What are the responsibilities of this cell membrane? Not only just it will allow the things to come in and allow the things to go out, it has some other responsibilities. So that the inside the house, every person can work freely, free of fear. Freely they can work inside the house because my door is closed. Nobody can come in my house. In this way, cell has a strict rule according to that. And after that, I told you, now we have entered into the cell. We open the door, that is permeability, pressure increased, and we open and we go inside. And what was inside? The whole total structures, whatever was inside, that is known as cytoplasm. And I explained you previously when I was discussing about the cytoplasm that just like our environment, we are living in this air. We do not feel any pressure, but there is 480 millimeter of mercury pressure is always on us. And when a child born comes out of mother's womb, he cries because this pressure was holded by the abdominal wall of the mother. This pressure was holded by the wall of the uterus. It was not going to the child at that time when it was in a mother's womb. But when it comes out immediately, that pressure comes on it and he cries. And with that cries in nature's process, air goes in. Oxygen is heavier than the carbon dioxide and all other gases. Air goes in and the lungs are flattened, which were lying squeezed. They flattened. And a process of respiration starts. Nature's process in this way. So ultimately, just like we go to the hill stations, and in heights we do not breathe normally because we are addicted to live in this type of environment where there is a pressure of 480 millimeter of mercury. We are normal, we breathe normally, just like the fishes. They live in the sea, all over water. We cannot live there. We have only movement 2, 3, 4, 5 minutes, or maybe somebody having more experience and more time he can live in the water, but not anymore. There is an environment. That sea water is environment for the fishes. This our environment is in our environment in the open air. That's with the mercury pressures. And in this way, when you enter into the cell, there is an environment, and that environment is known as cytoplasm. That kind of things with which all the organelles, all the living organisms, all the members of that house are living freely, fearless, and working normally. And now I'm saying that the barrier, the door has opened now or broken down. Anybody can in. And when anybody can in this environment, ultimately that environment be damaged. Then the all the organelles inside will not be able to work normally. They will, as long as they are surviving. There is a degree of deterioration. There's a degree that how far they can work, how far they cannot work. Just like in my previous lectures, I told you the first thing when it goes to wrong, that is known as inflammation. The second thing, when inflammation is not recovered, that is known as degeneration. When the degeneration is not recovered, that is known as necrosis. When the necrosis is not recovered, that goes to the gangrene stage. So it depends upon how much that environment of cytoplasm has been damaged by the extra entry from the cell membrane damage into the cell. In this way, I give you the example, one more thing before I going to stop this lecture today. Just like a milk has its own consistency. Water plus the minerals, whatever it has, it's a normal consistency. And you put something sour into that, renin into that, what happens? Just in Indian cultures, you know that we make the paneer, curd. And ultimately, what happens? The solid portion of that milk is separated. Water comes up, and those who are addicted to live into the environment of milk will not be able to live into the liquid portion, will not be able to live into the solid portion. It's easy example to understand. You all can understand easily that what happens in the cell if outsiders are extra, just like you are taking any medications which is not accepted to you, which is not accepted by the body. But you feel nervous, excitement, sweating, cold sweating, uh, anxiety. And you say, oh, this medicine is allergic to me. Oh, I cannot be that. Immediately, whatever injection, whatever medicine has been taken, you try to antidote that one because that is not accepted by the body. In this way, this thing happens because the environment of that, after entering those medications which you have taken, or anything which has gone inside the body, forcibly it has entered to the cell, and it will change the environment of the cytoplasm, and all the organelles which were working normally in the cytoplasm will not be able to work normally. Then you feel anxiety. If mother is not cooking food, what you will eat? There is a time you have to eat, you need, you hungry, you need that. Then what will happen? The same way, every person has its responsibility to do work in the home, and if they will not be able to work normally, what will happen? So same thing happens inside the cell. If the membrane is broken down, and everything or notorious things which were not required normally into the cell enters into the cell, then that causes breakage of the normal environment of the cytoplasms and starts the disease. So we are step by step. There are many more organelles. There are many more persons in the home, just like my mother, my sister, my wife, my kids. Every person has their responsibility to do work inside the home. In this way, inside the cell, there are many persons who are assigned duty to produce a normal life. And to produce a normal life, they should work normally. They should be healthy. And we are discussing all these things, that who is responsible for what work. And if this kind of work is not performed normally, which is represented by the organs, breathing, it means someone is responsible inside the cell who is responsible to produce normal breathing. And we see in the lungs are not working normally. We cannot breathe normally. Heart is not working normally. So in this way, we are trying to identify in these lectures that you should go deep into the cell, what is wrong and why it is wrong, so that you will be able to remove those things, so that you can get rid of the disease permanently. So now today time is over. We are passing through each organelle inside the cell, their duties, and if they become sick by any means, then what will result inside the body? What symptoms you will perceive from the body, that, oh, I'm not having normal respiration, I'm not having pain, having pain abdomen, or pain in the knees, or pain, whatever you feel. There's itching on my body, there are the eruptions on the body, there's eczema. Whatever you feel on side the body, ultimately it is all because something is not working normally inside the cell, and we are trying to trace it out one by one. So lastly, we have discussed by the cytoplasm, and after that we will discuss about the mitochondria, nucleus, and all these things. What is their responsibility, what they do inside the cell, and how they are responsible for producing a normal life go on. So Rabaraka, God bless you all. I hope whosoever is listening all these lectures, if they feel these lectures are benefited, please convey this message to your nearest and dearest, so that they can understand, they can listen these lectures and get benefited from these things. They be aware about their health before they become sick or more sick. They should be aware of the causes behind the diseases, and they can take normal measures to be healthy all the times. So I convey all this message to all of you, and as you know that on one day these lectures are in English, the other day these lectures are in Punjabi, on the other day these lectures are in Hindi. I am covering three languages, and so that every person who understand Hindi, understand Angrezi, understand Punjabi, they can understand very well the concept of body working, and concept of how they become sick, and what is going wrong inside the body. They can perceive it. Rabaraka, God bless you. I am your host, Gurdeep Singh Sandhu, homeopathic consultant. And again, my phone number is 408 687 1899. Email address, homeomedicine, HOMEOMEDICINE @yahoo.com. Anytime, if ever you are suffering from any disease at any age, and you want to take a second opinion about your disease, you can call me 408 687 1899, or you can send me an email about your health concern, and you will get your answer as far as my knowledge is concerned. So, Rabaraka, will see you tomorrow, and tomorrow this lecture will be in Punjabi, perhaps. Yeah, Punjabi, and after that it will be in Hindi language. And many more radio stations. This is Sabrang radio station. You can join Sabrang radio. You can download the app on your iPhones, Android phones, and you can listen every day these lectures. It's from 5 to 6 p.m. California Pacific Standard Time, 5 p.m. to 6 p.m., 1 hour every day. And uh, you can just even come to my Facebook media. You can bring send a request for the friendship, and I can just uh, say hello. Yes, we can continue, and you can listen these lectures on Facebook media and also YouTube. There are thousands of my lectures based on my 52 years experience of medical science, and you can go to that YouTube media and download that one. And also you can learn about any disease, anything, whatever you want to in these lectures. And for the current lectures, yes, please join Facebook media, join Sabarang radio stations, and listen all these lectures. It's for your benefit. It's for your benefit. Okay, there's no cost for that one. Just to download the app and listen these lectures. Rabraka, God bless you. We'll see you tomorrow in my Punjabi lectures from 5 p.m. to 6 p.m. Thank you.